Hello, I'm Daniel Garcia, your presenter for this training, which is for MGT 616, Organizational Change and Development and Management, with Dr. Barbara Leonard at the California Intercontinental University. So this is a presentation on CPOE and staff training at Springfield General Hospital. First, let's talk about the agenda. First, we're going to identify the problem. Next, we will identify the solution. We will talk about CPOE and what that is. We'll then talk about the change process and the teams that would be affected. And we're going to talk a bit about sequenced implementation, and then we'll have a chance for Q&A. So first, identifying the problem. So the problem is medication errors. Medication errors typically result due to similar sounding drug names, negative interactions of multiple medications that have been prescribed to a patient, patient drug allergies that are not properly identified. And you might be surprised to learn, but the most common medication error is due to illegible handwriting from physicians and other staff, which leads to errors. Okay, so let's talk a little bit more about medication errors. They kill or harm more than 770,000 patients annually in the United States. And these adverse drug events are responsible for several $100 billion annually. So it's a huge problem at this hospital and really nationwide. So let's identify the solution. So we're going to identify the solution as being CPOE. This is the computerized physician order entry system. It's basically a computer system. It is the process where a medical professional enters medication orders or other physician instructions electronically instead of on paper charts. So this is useful for reducing medication errors and increasing safety and accuracy. CPOE. So all the patient's prescriptions for medicine and treatment are entered into the system. All hospital staff have access to this system. So anybody that provides direct patient care also will have access to the system. The CPOE also includes a patient's complete medical history, and the system will be able to catch all prescription errors, including incorrect dosages, duplication requests, possible allergic reactions, and of course, with CPOE, you don't have to worry about the illegible handwriting. Okay, so now we're going to talk a bit about organizational change process. So organizational change process, you first identify the problem, which we've identified here as being medication errors. Next, you want to identify a solution to that problem, which we have identified as being CPOE. Next, we will introduce the new processes for implementing CPOE, and of course provide training to staff on how to use the new processes, CPOE processes. We're also going to collect data during this new process and this change to identify possible complications with the new process. And then finally, we will implement the new process at the hospital. So what staff teams are involved in this change? All medical professionals that provide direct patient care to physicians such as physicians, nurses, medical assistants, and others will be involved. There will be training provided on CPOE, and you will have support from management, of course. And we're also going to use some feedback. We want to get feedback from all staff, which we're going to use surveys and interviews to collect feedback on this organizational change and the implementation of CPOE and kind of what's working, what's not working. So we'll talk a bit here about what is sequenced implementation. So sequenced implementation. So first, we're going to use what we call a beta test. It's a pilot system that's going to be tested. A pilot CPOE system will be tested. So we're not just going to, of course, immediately start using CPOE. That would lead to probably even more errors, as we've seen in other situations. So the existing system will be maintained as we introduce a beta test. This pilot system, this pilot CPOE system will be introduced. And we'll have the opportunity this way to identify any issues with CPOE before we completely roll it out as a new process. So task alignment, management will identify key performance indicators required for exceptional performance, which will also assist us, of course, in this organizational, this process change. So thank you for watching. Are there any questions?